Hi everyone, today we're going to be talking about SIDE-ATICA. So, I didn't say SciAtica, I said SIDE-ATICA. So SIDE-ATICA is when pain travels down the side of the leg instead of the back of it. And the reason we differentiate it is there's a couple different problems that can contribute to it that are much different from sciatica. So Kate was just telling me about when she was experiencing it a little bit ago after a long period of studying. So Kate, can you kind of tell us what it felt like?
I was studying and then I started getting pain on the side of my hip and then I went all the way down my leg.
And how far did it go?
Just above the knee.
It went just above the knee?
Yeah.
Okay, so nothing down into the ankle?
No.
Okay, so sometimes with SIDE-ATICA, it can often travel down into and as far as the ankle, but it's not necessarily a problem with the sciatic nerve. And by definition, usually not a result of the sciatic nerve if it's SIDE-ATICA, and there's a couple other problems that we link it to. So we're going to talk about how to identify it today and how to deal with it if you're getting pain down the side of the leg and what it usually is. So Kate, what I'm going to get you to do is you'll lie on your right hand side with your head right there. And so usually the easiest way to find out if you have a case of SIDE-ATICA is to check the glutes on the side of the hip. The gluteus medius and the gluteus minimus, they are the most common cause of SIDE-ATICA. So with Kate, if we were to simply press down here, it doesn't usually feel good, but if she also noticed pain traveling down the leg, that's a really common cause of SIDE-ATICA. A couple of other common causes can be some irritation to the greater trochanter, and it could be greater trochanteric pain syndrome, which some people call bursitis, but is more accurately called greater trochanteric pain syndrome. It could also be a particular disc herniation in the low back causing irritation of that L3 nerve root down the side of the leg. It could also be, a tear in the gluteus medius or gluteus minimus tendon, which again would be similar to greater trochanteric pain syndrome. Or it could also be the sacroiliac joint, that big joint there where the dimple is in the back. So Kate, I'm going to get you to sit up, and what we're going to do today is we're going to talk about 3 great strategies on how to help relieve that pain, how to help prevent it in the future, and what might actually be a structural problem contributing to it if this is what you're experiencing. So let's go ahead and we're going to show Kate the first great strategy that you can use if you're experiencing SIDE-ATICA. So what you can do, I'm going to get you to stand up, and the first thing we're going to do is a really great stretch. So what you're going to do, Kate, is if the SIDE-ATICA is on your right hand side, you're going to stick your hip out like your Elvis Presley. Good. You're going to bring your left leg over in front of your right, a little bit more, and that's just going to act as a base of support in order for you to stretch the side of the hip. And what you're going to do is you're really going to stick your hip out to the side. Good. And where do you feel a stretch there?
Inside my hip.
Perfect. So that's the exact right spot. And then if you want to deepen that stretch, what you're going to do with your right hand, you're going to reach up and over. Perfect. So you can see Kate's formed this really nice C shape through the side of the thorax, and that's really going to help stretch the glutes on the side of the hip and even help target that sacroiliac joint a little bit there. So that's step number 1. Make sure that we stretch the glutes on the side of the hip. Now, the next thing that you can do at home to help with this is use the foam roller, and we're going to show you that next.